All right, everybody, it's 11 o'clock, so we're about to get started. We're still going to take it slow for the first few slides to give everybody a chance to hop on, but we want to get started because we've got a lot of exciting things to talk with you all about today. The title of our last Advocate webinar series for the year is Forward Thinking, What's New Next for Newly Implemented State Laws. And in this webinar, we'll be giving you a lot of updates on what's ahead in 2018 and ways that you can get involved. I'm here. My name is Julie Eller. I'm the manager of Grassroots Advocacy. I have been with the foundation for just over a year now, and in my role just for a few months, and I have been so thankful this year to be a part of this great community. Here with me today is Michelle Guadalupe. She's the director of our State Legislative Affairs team, and she is just awesome. She's going to be walking us through lots of information on our state implementation in 2018. To start off, I want to remind you that if you have questions during the presentation, feel free to shoot them in the Q&A feature. You can add them into the chat feature as well if that's easier for you. Or at the end of the briefing, you'll have an opportunity to unmute your line and ask your questions live. But please hold those live questions for the end of the briefing. So let's get started. I want to review with you all our 2018 Advocate Survey results. So if you remember, in August of this year, we had a great opportunity for all of you to share with us your top priorities for 2017. In the survey, you were able to provide us feedback with how you like to engage with us, what issues you want to see us tackle, what's most important for you as a patient, what barriers to care you're experiencing, and we wanted to frame our 2018 priorities based on your responses. So we've got a few things to show you. First, we want to let you know who our team is that is going to be responding to your needs and policy priorities for 2018. At the head of our department is Anna Hyde. She's our vice president, and she oversees our whole staff. On the federal side, we've got Vincent Pacilio, and Ben and Michelle are overseeing our state team. I oversee our grassroots team. And in the field, we've got Stephen Schultz, Claudia Stewart, Pam Fields, and Courtney Kowalaski. All of these people are great resources to you as we move through 2018, and we're committed to making sure your voices are heard on Capitol Hill and beyond. Here are the territories that each of our advocacy leadership team members in the field cover. You can see Stephen covers almost all of the West. Courtney's got that line in the middle of the country. And Pam is up north in our turquoise blue section. Ben covers our northeastern section of the country. Claudia is down south. And Michelle oversees the whole team, but also oversees our green states in the middle of the country. These are your resources throughout the year, and we're excited to provide you with their contact information next to their name. And this information is also available online. So let's talk a little bit about what your survey said and what were some of the results that are driving our work for this year. Well, first off, you had 3 top advocate priorities that were clear in everyone's survey. The number one thing you want us to make sure we're tackling is research for a cure for arthritis. Another challenge that you face every day is managing chronic pain. And the third is access to insurance coverage and providers. The top challenge that you faced were affordability of medications and the financial concerns that you experience as a patient. It was fascinating to see that many of you experienced similar prior authorization burdensome requirements and shared concerns about accessing your providers. These are the areas that we're going to tackle in both our federal and state work this year. And we want to emphasize that the reason we're tackling them is because of the stories that you shared with us and the feedback you provided in your surveys. So how are we going to do it on the federal side? Well, we're going to ensure that the voice of the arthritis community is heard throughout all healthcare reform discussions. We're going to make sure that as you address your chronic pain, we are going to increase the awareness and ease the burden of the overwhelming challenges that you guys face. The most important thing for addressing those challenges is at first making sure that the community is aware of them. And so by sharing your stories, we'll be addressing that as well. We want to raise the visibility of arthritis with policymakers so that we can ensure that the people who are making decisions in our country for healthcare and beyond have a good and comprehensive understanding of arthritis issues and chronic disease issues. We also want to reduce barriers to patient access, and we're going to accomplish that through the Patients Access to Treatments Act, which we've advocated on behalf of for many years now, which seeks to cap out-of-pocket costs for specialty tier drugs. We also want to make sure that we have patient-centered step therapy reforms, and we're addressing that through the Restoring the Patient's Voice Act. This would seek to address those burdensome or inappropriate use of step therapy protocols. We also want to make sure that we're increasing funding for arthritis research. So through our appropriation season, we're committed to growing arthritis research programs at the Centers for Disease Control and Prevention, the National Institutes of Health, and of course at the Department of Defense. We're also hoping to address the workforce shortages that we experience in our community, especially for our pediatric patients. And we're doing so through the Ensuring Children's Access to Specialty Care Act, which allows pediatric subspecialists to participate in loan repayment programs, thus making it easier for them to accomplish their medical degrees. And our final federal priority is to grow our Congressional Arthritis Caucus. We want to work with the caucus so that we can make sure our arthritis issues are heard on Capitol Hill and that they are acted upon. The best way that we can do that is by growing our numbers. We've got 140 members of our caucus right now, and we are not willing to stop there. So we're going to continue to make that a core ask of our federal policy priorities. Now let's look at some of our state priorities. Well, we want to reduce barriers to patient access, and that's true across the board. So we're going to supplement some of those federal asks with our state asks, especially when it comes to step therapy. While we're tackling that on the federal level, we also want to make sure that each state will help to have patient-centered step therapy reforms so that they aren't restricting access to those needed therapies for patients. We want to make sure that both patients and providers are notified when an interchangeable biosimilar substitution is made. And we've had great success in this area. We already have 36 laws across our country out of 50 to really address this issue. We're seeking to streamline prior authorization protocols and limit those lengthy delays and frustrations for all parties, our doctors, our patients, and our pharmacists. We want to tackle high out-of-pocket costs for those specialty medications. And especially, we want to prohibit inappropriate formulary changes, which can negatively impact a stable patient's ability to remain on treatment. As we address these issues, we also want to make sure that when these bills become law, that our patient communities really understand the new protections in their states. And Michelle is going to talk at length about that later, so I'm going to just use that as a preface for her conversation. We're also going to connect advocates with opportunities to engage locally. In 2018, we expect to have at least 8 state capital days. And finally, we're going to engage our network of state advocacy committees to really make sure your voices are heard in a major way. We want to make sure our active volunteers broaden our reach and visibility locally so that we can amplify our message nationally. One of the other things we found in your surveys was that the resources we are providing to you could be streamlined a bit better, that you might prefer things in short and sweet segments, and that you really would like to see our website become action-friendly so that you can participate from the comfort of your own home, in your own time, and at your own pace. So one of the things we're doing is establishing our video training center, where we're going to house all of our webinars. All of our tips and tricks are going to be available to you on YouTube and on our own website so that you can watch and rewatch and send to your friends all of the conversations that we have. We also have a really exciting new part of our website called our Action Center, and I want to take you through it really quickly so that you can understand some of the tools and resources we have. Here you see 4 buckets. We have actions, find elected officials, look up legislation, and do a quick sign up. For our actions, we are housing all of our action alerts in one centralized place. So you can log onto our website and look at the federal issues that we're addressing right now. You can send a letter to your elected officials or tweet them or get a phone script to call them all through our website. So let's say you select a step therapy action alert. We have a pre-populated email that you can edit and share your own story with so that you can send it on to your elected officials, encouraging them to sign on to this bill or thanking them for already having done so. These are updated in real time, so if your elected official has already signed on, they'll just get a thank you letter instead of a request. Another tool that we have here, which I think is amazing, is our Find Your Elected Officials tool. Simply by populating your address and your zip code, you'll be able to see all of the people who represent you, from the president down to your state elected officials. When you click on any of these names, you'll be met with a profile for your elected official. You'll see their capital address, their district address. You'll get all of their contact information, be it a phone number or a social media account. You'll be able to learn more about their family, what committees they sit on, and how they engage with their colleagues. This is a great tool for building those connections and getting that information at your fingertips quickly and easily through our website. The other great thing about this tool is that simply by checking off the box next to any of these names, you'll be able to compose a message, an email to your elected officials directly through our website. So we're bringing these tools directly to you so that it becomes easier to engage. We also have a lookup legislation tool where you can search any piece of legislation, either federal or state, find out more about it, learn who's co-sponsoring it, and where it is in the process so that you can engage more easily. These tools will allow us to accomplish more victories in 2018. But as you can see from our map, we've achieved 74 in just the years between 2014 and 2017. Our work has been wildly successful, but it doesn't stop here. And we want to provide you with a reminder that it is our responsibility as an arthritis community to not only see these issues from issue to bill to law, but also to patient protection. So I have one more slide for you to talk about our state fact sheets, which are going to go live on our website today, where you'll be able to grab leave-behind materials and easy to conceptualize facts for your state legislatures. These are great tools that you can use to advocate for arthritis, but there's still more work to be done, and that work is going to come from our implementation. So I'm going to turn it over to Michelle Guadalupe now, and she's going to let you all know about our upcoming state legislative session and our implementation plans. Michelle?
Okay. Yes, thanks, Julie. Can you hear me okay?
Yes, we can. Thank you.
Wonderful. I am excited because I love all these new resources that we have up on our website, and I hope that all of you on the phone are able to look at our website again and go through these different resources. I think they are really going to help us as we move forward with state legislation. So what I wanted to do is, before I really go into the 2018 legislative session, I just, again, want to say kudos to all of our advocates that have been so influential in what we've been doing all across the country. As Julie had shared with you, we had 74 legislative victories since 2014. This year, in 2017, we've had 17 bills passed and signed by the governor, and our advocates were there all across the whole process, whether it be, contacting your legislator, participating in media. That could either be through traditional media, or even so many of you were on Facebook, you were on Twitter, and really kind of garnering the attention of the different legislators and other important staff all across the country. We aren't actually done in 2017. This week alone, we had one of our ambassadors, she actually testified in both the Senate and the House in Wisconsin for the biosimilars, because that is a state that hasn't passed yet. So we had that going on this week. And then later on this week, we actually have one of our ambassadors will be testifying on our bill to limit step therapy in Massachusetts. So even though many of our legislative sessions are over, there are still some sessions that are still going on, and our advocates are there every step of the way. Julie has kind of showed you all that map where your advocacy team is located all across the country. We have been very busy in reaching out with our different partners and really working on our coalitions because many of our victories are done due to our advocates as well as due to many of our other patient and provider partners. So on our next slide, I do want to make sure that all of you are signed up as advocates. If you aren't receiving emails for us, that's okay. You can go to arthritis.org, and it's very simple to sign up to become an advocate. You'll want to do that because that is where you're going to find information, state, federal, you name it. We have actually been working with our state advocacy chairs, so some of our most active volunteers in the states, on sending out some state update emails. So make sure you watch your index. Those are getting ready to be sent over the next couple of weeks. And in there, we're going to talk more specifically about your particular state, what we did in 2017, and some of our 2018 plans. As I mentioned, we are working as a team, looking at, what do we still need to accomplish in the states, and there's quite a bit. We are going to be really looking at those patient access issues that Julie had talked about, biosimilars, step therapy, prior authorization, mid-year formulary changes, those high out-of-pocket costs. And when we were looking at all of our expected action in 2018, we are going to be in at least 37 states. And that is going to mean that we're going to be continuing, of course, to work with all of our dedicated advocates and ambassadors to make sure that we can get many of those states across the finish line so that we can, celebrate those different successes. On the next slide, Julie had mentioned that we definitely had some of those amazing victories, and we want to make sure that you all know that some of those victories are going to be enacted and into law where they're going to be benefiting our patient community. And we really want to focus our efforts in 2018 in, celebrating these different victories, as well as making sure that our patients and providers are all educated that this law exists, and making sure that we're providing you with the tools and resources that you can go and spread the word that these are going on and that our patients can have these protections. So as you can see here, Colorado, Iowa, Illinois, Missouri, New York, Texas, West Virginia, these aren't all inclusive on the states that have had step therapy, but these are what we're going to be focusing on, many of them going into effect in 2018. Prior authorization, we've already done some work around Ohio and educating our patient population, but we'll be continuing to do so in that state, in Indiana. And then Washington, D.C. had a great victory this past year on helping with costs with out-of-pocket. So these are just some of our different implementation targets that we're really going to start making these different resources for all of you. And like I've mentioned before, you, our advocates and ambassadors, are why these victories happened, and we definitely want to make sure that you are all informed and educated on how this is all going to actually play out so that you can get these protections. So how will we do this? We have started doing this already in offering webinars, but we will continue to offer webinars. We will make sure to provide you with that real succinct information that you can share with each other as well as your providers. And also the third bucket, which I'll go into in a little bit, is providing outreach to insurance commissioners. All right, first I want to talk a little bit about our webinars. This is a fantastic way, just like we do with these webinar series, it's an opportunity for you all to hear from us live, and then there would be that opportunity for questions and answers. And we feel it's really important on these different webinars that we, in many cases, will have an advocate who is involved in the process, as well as having an expert on. Just to give you an example, we had a great webinar earlier this year and we partnered with the Ohio State Medical Association. And so they provided some expertise on that particular webinar. We had one of our platinum ambassadors talk through her specific situation. And it was just a great opportunity so that patients, providers would know what steps they needed to take to make sure that they're getting this particular protection with prior authorization. Next slide, please. We definitely will continue. We've been doing this already, talking about our, when we have, bill signed into law, we've actually been really building up our blog series. So we will have blog posts, email alerts on all of our victories. We will be continuing to do this. We talk about actually translating them into action, and we will be sure to we keep on sending these out along with just those educational resources. We've actually had some of our patient advocates, we had a bill passed in 2016, and it went into effect right away in Indiana on our step therapy bill. And we actually had heard that some of our patient advocates were educating the providers on that particular bill. So that is the power that you all have been showing us, being able to take that information and run with it. So thank you for your ongoing support and what you do with our program. But those educational resources, we want to make them short and sweet, making sure that you are aware, okay, is this step therapy bill passed? What does that mean? Am I able now to get the prescription, that my doctor had originally prescribed? If there are any pitfalls that you're experiencing, what can you do with that? Not only do you talk with your insurance company, but we also want to make sure to empower you to know that you have other protections that you can use, and that is outreach to your state insurance commissioner. So if you're experiencing these barriers, if you feel that, that you are not getting anywhere in the avenues that you've already tried, your state commissioners are there to help. And our Arthritis Foundation, we have made outreach to many of our state insurance commissioners, and by far, they said the number one thing that they need you to do is to share your story. And we want to make this extremely easy for you. We actually have a website. It's at one of our partner websites. You can go to coveragerights.org. It can go by state, and you can find easy instructions on how to contact your insurance commissioner and how to file that complaint. When we have said to them, well, we've been hearing from this number of advocates, they've told us, their story, they said, you know what, Michelle, that's all fine and good, but we need them to actually contact our office directly. So we want to make sure that in 2018 that we are going all of these different aspects, that we have our educational webinars, that we have those educational resources, and then we also provide you the tools so that you can make additional outreach to your insurance commissioners if things aren't going as planned. So that is just a real quick rundown of 2018. We are super excited that we can focus our efforts more in this area, and are super excited to have our advocates and ambassadors help us all along the way. With that, I'm going to turn it back over to Julie so we can do the questions part of the webinar.
Thanks so much, Michelle. So again, if you have questions, you can simply chat them to us in the Q&A feature or in the chat feature, or you can use this moment to unmute your line by simply pressing #6 and then asking your question live. All right, well, it sounds like we don't have any questions coming in, so I'm just going to ask a question myself to Michelle and just say, for 2018, Michelle, what is the one piece of advice that you want to give all of our advocates on how best to share their stories with us and with their insurance commissioners?
Great, thank you. Well, first, I really hope that everyone on the phone, that you connected with the staff, with us. We really do want to hear your stories. Even if you have questions on, well, I'm not exactly sure how best to share my story, that's where we can come in and help you. We really also, I think the Action Alert Center is an amazing tool, and that is something that is easy to use, and you can share your story right there, and they're going to give you a lot of different tools and tips. We will definitely reach out to you as well. because our experience has been that Arthritis Foundation staff, we aren't the ones that are really, making these victories happen. It's because of our advocates and ambassadors. I can't tell you how many times that I have gone through committee hearings and the legislators, their ears perk up when they hear from our advocates. The advocates are the ones that get asked the questions, and I'm told that, that's what really kind of makes the difference, is having that personal connection, those personal stories that they're hearing, like, wow, okay, my constituents, this is actually happening to them, and this legislation is going to help them. So definitely, and don't ever be shy about telling your story. Your legislators want to hear from you. They want to be able to, make a difference for their constituents.
Beautiful. Thank you so much, Michelle. So we're going to finalize or end our webinar today with a reminder that we're going to be having our Platinum Ambassador Assembly this March on the 12th and 13th, and that if you're interested in joining us in our future leaders track, please join us for our next webinar on December 19th. It's going to be an interest meeting where you'll understand better all of the criteria that you need to meet in order to attend the event, and all of the tools and resources we'll provide for you. Information on our dates and topics for 2018 will be available on our website soon. And if you have any questions between now and then, please feel free to reach out to me, visit our website, check out our Action Center. My email address is jeller@arthritis.org. You can reach out to me by phone or even by Twitter. Thank you for joining us all today, and thank you for Michelle for sharing so much of our state implementation efforts. We really had a great time talking with you all, and please don't hesitate to reach out with any questions. Thank you so much, and have a happy holiday.